Good morning to all. My name is Dr. Alex Matin. I am working as an assistant professor in the Department of Faculty of Pharmaceutical Sciences, Rama University. Today I am going to present on the topic COPD. COPD. What is COPD? COPD means chronic obstructive pulmonary disease. It is a type of disease which is characterized by airflow limitation by the lungs, which is caused by emphysema and chronic bronchitis. Now, let us see, this is our basic structure of our lungs. And this is our windpipe, which is also called trachea. Now, in a healthy person, what is actually happening? In a healthy person, this is our trachea, which has lumen, smooth muscles, and trachealis muscle. Now, what happens in a COPD patient? This lumen gets narrow due to the inflammation of the smooth muscle. So, this lumen gets thicker, and due to inflammation, the size of the windpipe reduces. Now, what is chronic bronchitis and emphysema? Chronic bronchitis means the inflammation of the lower respiratory tract, which is due to the excessive mucus secretion, dyspnea. Dyspnea is also called shortness of breath. And now, what is emphysema? Emphysema is a complex lung disease in which the is gas exchange process gets affected, and as we know, the gas exchange takes place in our alveoli of our lungs. Now let us see the diagram. This is an alveoli of a normal healthy person, which has this windpipe through which the airflow takes place, an alveolar wall, and this is our smooth muscle. Now in a COPD patient, this windpipe through which our airflow takes place gets narrow because of the fibrosis and the hyperinflammation of the windpipe. So due to which this gets narrowed, and the person is having a difficulty in a breathing. And the most common process is that this COPD is not reversible at all, while asthma disease is a reversible process, and it after treatment and proper management it get reversed. Now, what are the risk factors of COPD? The first and the most important risk factor is the people who are doing this consumption of smoking, tobacco, and the people who are doing the passive smokers. And next, the occupational exposures like some people working in mines or dust, in a dust environment. And next, the genetic abnormalities including the alpha 1 antitrypsin enzyme. Actually, what is alpha 1 antitrypsin enzyme? It is an enzyme which is produced in the liver, and after produced it is sent to the lungs, as it protects the lungs from all the infections which has been occurred or will take place in future. Next, what are the clinical manifestations of COPD? Clinical manifestation means what are the basic symptoms? What are the basic signs which we get to see in a patient having a COPD? The first one is the cough, sputum produced, second, and third is the very important dyspnea on exertion. Dyspnea, as we know, dyspnea is the shortness of breath, and exertion means doing any type of physical activity like brisk walking, running, anything related which does the exertion of our body. Now, what are the key factors to assess in a patient having a COPD? Now, first one is the what exposure that person is working, like what are the types, intensity, how much hours that person is working in a mine industry or a dust, any chemical type industry. Whether now next, whether that patient is taking any past medical history related, any respiratory problem, like any sinusitis, history of any respiratory infection, any previous MDIs used, or next, any family history related, whether father or grandfather, mother, anyone is having any issue related to the lungs, any history of exacerbation. Exacerbation means the worsening of any symptoms like chest pain or chest tightness, shortness of breath increases suddenly after any work. Now, next is the presence of comorbidities. Comorbidities means any other disease along with COPD. Having a multiple disease together is called comorbidities. Any appropriate of current medical treatments, any impact of disease, any past previous disease he or she must be having which have affected the quality of life of a patient. And the last, the potential for reducing any risk factors. Now, let us see what are the tests we have to do to diagnose the COPD. Now, first one is the pulmonary. As we know, for the lungs, we have to do PFT, which is pulmonary function test, which is used to determine what is our disease severity, any disease progression. And in that pulmonary function test, we have spirometry, which is used to check what is the airflow level of a current patient. And next, the arterial blood gas, from which we can get to know about the gas exchange which are taking places in our alveoli, whether it is oxygenated properly, working or not. And through the chest X-ray, we can get to know about any infection or any abnormalities which are present, lung size. These all things come under our chest X-ray. Now, after the chest X-ray, we have alpha-1 antitrypsin deficiency. As we know, this alpha-1 is produced in our liver and then it is sent to the lungs. So, for the checking of this, first the patient age should be less than 45 years of old and it should be compulsory for all the patients whose family history has a COPD. Now, next, what are the complications of COPD? What are the various diseases that can cause after the COPD? The first one is respiratory insufficiency and respiratory failure. Now, as we know, COPD is also a lungs disease, so it can cause respiratory insufficiency and respiratory failure, which are life-threatening. And the next is pneumonia and respiratory infection, the right-sided heart failure, pulmonary hypertension, pneumothorax. Pneumothorax means the space between the lungs and chest. The air gets filled inside the both. Next, the skeletal muscle dysfunction, depression and anxiety disorders. Moving to next, what are the objectives of management of COPD? Now, first, the 3 steps we have to take. The first one is to the relieve symptoms. The next is to prevent the disease progression. Progression means the duration, the intensity of the disease. The third is to reduce the mortality. As we know, mortality means the death, the person's death. To decrease that and to improve exercise tolerance. As we know, if we put exertion on a patient, this will cause the dyspnea to the patient. So we have to reduce that also. And the last, to treat and prevent the complications of COPD. Now, what are the medical managements of COPD? The first one is non-pharmacological, which is the most common that we have to do to tell the patient regarding smoking cessation. As we know, smoking is very various injurious to health, and it is the patient having COPD should stop the taking of smoking, or he have to completely quit the smoking. And the next, the pharmacological therapy of COPD. Now, what drugs we can use or we can give to the patient to get a good quality of life? The first one is bronchodilators. As bronchodilators, they help in the airflow obstruction. They decrease the airway obstruction so that the breathing through alveoli takes place much smoother. So how this bronchodilators work? The best example of that bronchodilator is MDI, which is metered dose inhaler, which is both in pill or liquid form. This is our metered dose inhaler. It contains the powdered version of bronchodilators. Now, this is a device, and let's see how to use it. This is a spacer, this is an inhaler. Now we have to attach this inhaler's bottom part to the spacer. Then the patient will keep this in the mouth, and the person will pump it how much the doctor has advised him or her to take. Next is corticosteroids. These are the drugs which are less used in COPD, and it is mostly used in asthma patients. As corticosteroids help to decrease the symptoms of COPD. What are the other treatments or medications that can be used to decrease the COPD? Like, the patient should take after every 5 to 7 years the pneumococcal vaccine. The patient must compulsory take, mandatory, he should take every 5 to 7 years this vaccine to prevent the symptoms of COPD. Now, how to manage the exacerbation? As we know, what is exacerbation? The worsening of symptom. How to manage them? Now, the first one is we have to early diagnose the sign and symptoms of COPD and help to take a good doctor and take a proper treatment for the betterment of yourself. There is some other treatments also available for the COPD, like oxygen therapy. Now, what is oxygen therapy? Oxygen therapy means it is a long-term therapy so that the patient's quality of life gets improved. This therapy is for the patient who gets bedridden. Thank you. आगे और भी है क्या? Now next, moving to the surgical management. What are the surgical management which are provided? The first is bulectomy. The air sacs, they get separated during the operation, they are removed. Next, we have lung volume reduction surgery. The size, some portion, the dead cells of the lung gets removed in this process. And the last, we have lung transplantation. Moving to next, what are the other steps? That is pulmonary rehabilitation. In this, we properly manages the patient's quality of life by improving their lung function test, telling them how to be emotional, how to be mentally fit. What are the components? General exercise training, breathing retraining, outcome assessment, nutritional advice, education, and psychological support. This, as we know, these are the treatment chart. What we can do is, first we have to stop smoking cessation, then inhalation of corticosteroids, bronchodilators, we are using like an MDI, pulmonary rehabilitation, and surgery. The last, the patient education is very important. As we know, the patient must know what he is exactly, what state of level he is facing, what are the pain intensity, what is his quality of life. So we should tell the patient to take proper rest, to take proper medications, and take the proper follow-ups. Thank you.